Hi, Dr. Timothy Gallagher here from Marigal Medical. This week we have a special guest with us. We have my mom, Joyce.
Hi.
And she was one of the first patients to actually go through our Neurogenx treatment for neuropathy. This week we're actually going to get a patient account from my mom. She's going to talk about her experience with the Neurogenx treatment for neuropathy. You're going to get some great information, so stay tuned. All right, this is great. So welcome, Mom. This is our first video together.
I think this is wonderful.
All right, I appreciate you doing this.
Absolutely.
So, Mom, I think it would be great if we talk to our existing patients and then some patients maybe out there that have been watching our videos and talking to them a little bit about this new neuropathy program, Neurogenx, that we have in the office. This is a FDA-approved protocol that helps to treat symptoms associated with neuropathy, and that's something you know a lot about because...
Certainly do.
Yeah, so you have neuropathy, right?
Yes, I do.
And how long have you had the neuropathy?
I've had neuropathy going on 9 years.
Right.
And when I was first told about neuropathy, that I would have it through my chemo and surgeries that I encountered through cancer, they said, you feel probably some tingling in your fingers, your toes.
Yeah.
It came to a point where I had a very terrible time sleeping.
Yep.
It was all interrupted sleeping, and it was very painful. I couldn't get comfortable, and it did last quite a long time.
Yeah. And that's the challenge too. You know, we talk about our treatment with Neurogenx. It's an approved protocol with diabetic peripheral neuropathy, but it can also help patients with other forms of neuropathy. And in your case, you have a chemical or chemo-induced neuropathy, which, you know, we had to have the chemo.
Right.
That
Absolutely.
took care and stabilized the cancer, which we're so thankful of the
Yes.
last 9 years.
For sure.
But one of the side effects of that is the neuropathy. And, you know, we've noticed over the last several years too, you know, you've been complaining about your feet. But not only that, we've noticed a couple of episodes too where it's affected your balance.
Absolutely.
And you've fallen a few times.
Yes.
Yeah.
Luckily, those 3 falls that I had were what I would call minor
Yeah.
and very embarrassing situations, but
Right.
they did occur.
And they were almost kind of like a warning shot for us to
Yes.
say, okay,
Something's going to be done.
yeah, we dodged a bullet and we got you involved in the clinic and treatment. And we've done some really great work, and you and Colleen on the Hanover robotics.
Absolutely.
And then you kind of transition, we're working with Ashley with that, and you know, that definitely helped on the balance side.
Yes.
But with the neuropathy, what's exciting is this new treatment option has actually been proven to not only help alleviate symptoms of neuropathy, but also to help restore some of the damage and repair the damage to those nerves. So we actually can see an increase in the nerve fiber density. The treatment itself, how would you explain? How uncomfortable is it? What does it feel like? What time of day do you get it?
I get my treatments in the afternoon, okay? As far as pain is concerned, it depends upon your tolerance. And I actually can say that I watch for the needles to go in.
Yeah.
And I say to myself, this is not going to hurt me.
Right.
This is not going to hurt me because of the lidocaine that's going into to numb my area in both my legs.
So for
down
those
to
of
my
you
toes.
who need a little explanation too, the treatment itself is kind of broken up into 3 parts. The first part is an examination, a diagnostic test called TM flow. And what that does is it actually looks at the blood supply in the lower extremity. The actual treatment itself comprises of a nerve block in 2 nerves in your legs, the terminal sciatic nerve and then the saphenous nerve. We do that on both the legs. So what my mom was referring to is the nerve blocks themselves, just to help to kind of numb the area. And the actual treatment is a form of high intensity electric stimulation. So we put those electrodes on your leg, and
Yes.
we have a protocol that we follow where we increase the intensity over time. And what we are able to do, because you have had the nerve block, is you're able to tolerate a higher intensity of the Neurogenx stimulation, which from a physiological standpoint, it really helps to just open up the sodium and potassium channels within the nerve to allow better exchange of nutrients, which in the long run helps the nerve to repair. So in terms of your symptoms with neuropathy, what is the neuropathy symptoms? What does that feel like? And what time of day do you feel that the neuropathy symptoms feel worse for you? Is it more in the morning, or is it more at night when you go to bed?
At night, when I go to bed.
Yeah.
Yes, definitely.
And you started treatment with the Neurogenx, I think a little over the 2 months.
2 months, yes.
And the treatment itself is a piece of cake. If we were to talk to somebody about going through the treatment, we talk about getting a nerve block. Oh, that must be painful, but it doesn't really hurt, right?
No, it doesn't. And I'm at a number 7.
Yeah, so there's a
Number
protocol.
7.
She's referring
Yes.
to the levels of the stimulation as we
Stimulation,
increase
yes.
it over time, which
Right.
is great. And then what have you noticed over the last couple of months in terms of the benefit from the Neurogenx treatment? What level of improvement have you seen? Have you noticed less symptoms at night? Has it helped you with your balance and your walking?
Absolutely, I would say 100%. Number 1, nighttime is a pleasure going to bed.
Good.
My feet feel wonderful.
Yeah.
And secondly, I feel confident in walking. Whereas before, after the falls, and even my treatments that I had for that purpose, I was still a little bit leery, and I always said, I'm not going to be this person that walks with their head down, watching every step you take. And I feel very confident. I am careful, but it's not a noticeable type of carefulness when I'm walking. I feel more secure. My feet feel solid.
That's great. And
Yes.
for those that don't have neuropathy out there, what my mom's referring to is that, how it affects your balance, because when you have neuropathy and when it damages those nerves, it's affecting what we call your proprioceptive ability. It's your body's ability to tell itself where it is in space. So if you think about it, if your foot falls asleep and you go to get up and walk, and your foot feels kind of dead, right? So you don't have that, feedback. You don't know where your foot is. And of course, you'll lose your balance, right? And if your foot falls asleep, well, after a few seconds, it'll come back. But think about it, if you have neuropathy, and when there's permanent damage to the nerve, and you're living with this constantly,
Right.
It's a major problem, because not only does it affect your balance, but then you start to walk in a more abnormal pattern. You're compensating. We started to notice in your case, you started to develop some knee pain, which we were able to successfully treat with those stem cell injections,
yes.
which really worked out well.
Yes, very good.
And just the fact that now we have a completely safe treatment option that not only helps alleviate the symptoms with neuropathy, but also helps repair the damage to the nerve, is just a game changer. And I think too, if you were to run into somebody that was thinking about going through the treatment, what would you tell them?
I would, what I've told you, that I'm an example, because I spent many nights not being able to sleep. And this has really helped me tremendously.
Oh, that's awesome.
It's just been wonderful. Not only that, but my feet feel more solid for some reason.
That's great.
More solid.
And you're not saying that just because you're my mom.
Absolutely not.
Well, that's great, Mom. I really appreciate it. Folks, if you're interested in inquiring about treatment options for neuropathy, you're definitely going to want to give the office a call at Marigal Medical. More information is found on our website at marigalmedical.com, and we've got a wealth of information on our YouTube channel. Please consider subscribing, and you can actually check out the video that my mom was in, where she's actually going through the treatment. And best yet, our office takes most insurances. Well, that's it for today. I hope you learned something, and thanks again, Mom, for joining us, and thanks again for sharing your experience with all of our
Absolutely.
patients.
There is a cure.